All right, we're just about ready to get going here. Just a few more people that are signed up trying to log on. I'll tell you what, I'm going to put a little 1-minute timer on here, and then we will get ready to get started in just 1 minute. All right, I guess it's time to get started. Looks like everybody that's going to be here is signed on. So let me quick introduce myself. I'm Dr. Ingo Mahn, and just give you a real quick little background on myself. I graduated from Marquette Dental School in 1985. I founded Natural Dental Partners here in Phoenix about a year ago, and that was after I had practiced dentistry in Wisconsin for about 31 years and built a large holistic dental practice there. In 2004, I really kind of got started with holistic dentistry back in around 2001 or so. And then in 2003 and 2004, I did a doctorate in integrative medicine because I just really wanted to learn more. There were so many things that I had no idea what I was getting myself into when I got into holistic dentistry and didn't realize how much I had to learn. But I wanted to have a good background so I could communicate with both my patients as well as the practitioners I was starting to work with. I'm an accredited member of the IOMT, which is the International Academy of Oral Medicine and Toxicology, and I'm also a member of a number of other organizations. And I'm a founding member of the Academy of Ozone Therapy, and that's something we'll talk about in just a little bit because I'm a big believer in oxygen and ozone therapies because I think they're very powerful and effective. This is me. This picture was actually taken about 3 years ago up in Sedona. This happened to be taken the day that we purchased our home here in Arizona on my wife's birthday. And it's, when you look at your little, this was almost 3 years ago now. You look at my little peanuts there. I think you're just about as tall as my wife, my son is at least. And there's actually a little dog here that you can kind of hard to make out, but that's my family. And so as far as questions go, it's a little bit hard to do a webinar and to answer questions at the same time. So what I would suggest you do is if you do have a question, go ahead and write it out and then just email it to me at this address, the info@mynaturaldentist.com. You can also give us a call, and I'll give the phone number at the end of the webinar, and get a copy of my book. And this is something that we actually send out to all our new patients just so that we're all on the same page. And some people know a little bit more about holistic dentistry. Other people are just getting introduced to it. So this is there's a lot of good information in this book. All right. So the goal for the presentation is I do want to give you, even if you're already a little bit aware of some of the concepts of holistic dentistry, I want to give you more of an insight into the whole oral systemic connection and the role that holistic dentistry plays in helping you achieve better health. I do have some more interesting information about amalgams, about root canals, and then especially about implants and some of the new imaging technology that we're doing. And those are really, when you see some of the things that we're doing now, it really is an exciting time to be a dentist because we get to work with some really, really great tools that help us do things that were difficult to achieve before. And then I do want to talk to you a little bit about the power of oxygen and ozone therapies. All right. So, a lot of times people go, what's a dentist doing, talking about overall health? And when you look at toxicity in general, when you look at a dental office, there's a lot of toxicity stuff going on in there. There's, mercury from the amalgam fillings. A lot of the crowns have nickel in them, and who knows what other kinds of metals. There's electrical currents being generated when amalgams are left underneath crowns. there's toxic filler particles and composites, all the bacteria and toxins associated with gum disease and root canals. Of course, the whole fluoride issue, which we're not going to get into today, but that's actually a topic I could, I've done whole talks about that. But there's a lot of nasty things going on in dental offices. And, that's why holistic dentists, not so much conventional dentists, but holistic dentists really have become very conscious about how to deal with those toxins, because they're at the root of a lot of the problems that our patients are having. And this here was really the statement that kind of first got me interested in holistic dentistry and kind of opened my eyes, because I thought even if this German physician is wrong, it still makes the mouth an incredibly important part of your overall health. And he doesn't say, I'm thinking 80% of all illness is related entirely or partially to problems in the mouth. He's saying based on 40 years of research. And that really kind of got my attention. The other one was this Dr. Thomas Rau. He's the medical director of the Paracelsus Clinic in Switzerland. And he's actually a really interesting guy. He's a huge believer in having a dentist be part of the medical team. And in fact, when you go to his clinic in Switzerland, the first doctor you see is the dentist. And I was fortunate enough not too long ago to see him speak at the Southwestern College of Naturopathic Medicine. The only thing I was really disappointed in was that here's this guy from Switzerland with all of this phenomenal information, yet in this big room, there were probably only about 20, 25 people to watch him lecture. And he did make some really interesting comments. I was fortunate to get up and, speak with him a little bit beforehand. And he kind of, again, told me how important he thinks holistic dentists are in his quest to help his patients get better. And he said, here are these patients that show up from all over the world, but primarily from the United States. And he said they show up with their suitcases full of laboratory tests, and they're coming from the Mayo Clinic, from the Cleveland Clinic. He says nobody has ever looked in their mouths. And he was talking about the phenomenal results that he's getting by looking at their dental problems and looking for infections and looking for toxins. And he says, I won't even sit down and do a consultation unless I'm holding the patient's dental panoramic x-ray in my hand. And I'll show you what that looks like. This is actually, he's got one up on the screen right here. And I'll also show you some of the really cool new imaging technologies that we have now that actually far exceeds the capabilities of a panoramic x-ray. So the good news is that some of these things are starting to trickle into the more conventional dental community. And this was a dental journal from about a year ago, and they're talking about the oral systemic health. And not only are they talking about how oral problems cause, let me repeat that. Not only are they talking about how problems in the body are causing, for example, problems in the mouth. For example, if somebody has diabetes, how that reflects in their gum tissue. But interestingly enough, how oral health affects people's systemic health. And that really is kind of that's kind of what's differentiated holistic dentists, is that we believe in what's called this focal infection theory, meaning that a problem here in the mouth does have an effect on the rest of the body. And that's something that conventional dentists have kind of made fun of us for over the years, but now they're kind of admitting, yeah, this actually does exist. And the first place was when you were talking about the connection between gum disease and things like cardiovascular disease and diabetes, and also how important nutrition is for oral health. So let's just, real quickly talk about some of the amalgams. A lot of you may be familiar with the amalgam issue, but the question has been, are the silver fillings a safe restorative material, or is it, as holistic dentists claim, this continuous source of toxicity? And if you're not already aware of the composition of these, quote unquote silver fillings, they're in fact 50% mercury and only about 35% silver fillings. But of course, we weren't allowed to call them mercury fillings. In fact, there was a time when I practiced in Wisconsin, if we called them mercury fillings or talked about this mercury, we could actually lose our license. Whereas in places like California, if you didn't inform a patient that these fillings were 50% mercury, you would lose your license. So That's how crazy things are in the dental community. And then there's a number of other metals in there. Now, we were told that these fillings bind the mercury. Now, Dr. David Kennedy showed, and this is a 25-year-old dental amalgam. Here he rubs it with a pencil eraser, and he's able to show with this phosphorescent screen that there's mercury vapor coming off. And if you Google smoking tooth, here's a filling that's been dipped in the temperature, that you would be drinking a cup of coffee or tea with, and look at the outgassing of mercury gas from these old fillings. And that's really the problem, is you have this fine little aerosol of mercury droplets throughout these silver fillings, and throughout the whole life of that filling, it will outgas these mercury vapors. And it's kind of interesting. This has always been one of, when I do presentations, people always get a kick out of this slide. And it's that the FDA considers mercury to be toxic before it goes in the mouth. The EPA considers mercury to be toxic after it leaves the mouth. We now have to have mercury filtration systems on our dental equipment. So when we're taking out the old fillings, we're not dumping it in the water supply. But apparently, according to the American Dental Association, mercury is safe while it's in the mouth. So, this is one of those go figure things. And of course, if you know the history of the American Dental Association, you know that their whole existence is based on the foundation that amalgam fillings were okay. And that's why they're really kind of hanging on to that whole concept. And the problem with mercury is really that people sometimes study just one thing. So they say, this mercury it's not that much of a problem. Of course, we know that everywhere in medicine, mercury has been eliminated, and there's no such thing as a safe dose of mercury. But the problem is that when you combine it with other toxins, the toxicity is really greatly compounded. And one study showed that if you took a dose that only kills 1 out of 100 rats of mercury, and you take a dose of lead that only kills 1 out of 100 rats, when you administer those simultaneously, instead of killing 1 rat, you kill all 100. So it shows that it depends on what you've been exposed to in your life. So if you were exposed to lead when you were a child and somebody puts in an amalgam filling, now that's a much bigger problem than on somebody who's eaten maybe a good diet and hasn't been exposed to that. And it also really, on the other hand, if you've had the amalgam fillings, now in the future, when you have other things that you're being exposed to, it makes you much less able to deal with those toxicities. And this is one of my favorite little cartoons, because you've got 7 new fillings on your left side, and just kind of reminds us that mercury is a heavy metal. But we're slowly starting to get it in the dental community. So fortunately, less and less dentists are placing the amalgams every day. All right. So what makes a holistic dentist different? This is probably the first question I always get when I tell people I'm a holistic dentist. By the way, that first slide you saw with the hot air balloons was about 10 minutes east of my office when I drive to work. And this is about 10 minutes west of where I practice on Lake Pleasant. I brought my little fishing boat down from Wisconsin, and I love to just get out there and get on the water for a little bit now and then. And if you look, there's actually some wild burros there. So it's just a good little therapy to get out on the water and relax after a long day of taking out amalgam fillings, get a little fresh air. But this is always the first question I get. They're like, well, even just at a seminar I'd been to, other dentists came up, and the nice thing is they're actually starting to ask questions now. 10, 15 years ago when I started doing this, if I told someone I was a holistic dentist, they'd give me a little pat on the back and go, oh, that's nice, and walk away. But now they're actually starting to ask some questions, and they're starting to hear these things, and they're starting to ask themselves the same questions I did back then about, what are we doing to people's bodies when we're putting these materials in their mouths? And it's kind of that's besides the technology, this is what also makes it an exciting time to be a dentist, because now we're starting to look at the whole body. So the biggest thing that really differentiates me as a holistic dentist is the whole amalgam removal protocol. That's really why probably a majority of the patients come to our practice, because they're looking they hear about amalgams containing mercury in it, and they're saying, hey, what can I do to get these things out? And not just get them out, but get them out safely. So these are some of the steps that we take to protect you during that removal process. So we're using something called a rubber dam that kind of isolates the teeth that we're working on. We cut the fillings into bigger pieces, so we're not drilling them out in these tiny little chunks. We use an additional vacuum that goes right below the patient's mouth and pulls all of those mercury vapors away from the patient's face and nose. And then we're also using some good air filtration, negative ion generators in the room. And then this is an important step. It's the bentonite clay that people will actually swallow a little bit of this before the procedure and then rinse and spit it out after the procedure. That way, if you get any little chunks that get underneath the rubber dam or anything gets swallowed, it'll get absorbed by the bentonite. And then also, it's also recommended that nutritional and immune support, and a lot of our patients go do some IV vitamin C or take some lipospheric vitamin C to help protect your immune system after that amalgam removal step. So we're doing everything we can to be as gentle on the system when we're doing that removal, but every little bit helps. So step one is getting them out safely. Now the second step is, what do we replace it with? Now this is actually a picture here of one of our operatories, and we actually call it a mercury safe operatory now, because in the past what's happened is a lot of dentists call themselves mercury free because they're not placing amalgams, when in fact the really critical part of that procedure is the safe removal, because that's really where you can get exposed to a lot of those mercury vapors, and that's a very dangerous form of the mercury. And here you see that suction unit. This is actually from Switzerland, and this creates a high volume flow of air, and it draws all of those mercury vapors away from the face. And then we also use the negative ion generators, and this one also happens to produce ozone, and we use that to also keep our rooms nice and disinfected. So the second step is, of course, trying to figure out what materials to replace the amalgam with. And we always have that challenge of finding the most biocompatible materials. So we do start with materials that are overall healthy. For example, the mercury is pretty much toxic for everybody. And then there may be other materials like, for example, nickel or zinc or tin that certain people may have higher sensitivities to. But we always want to start with a material that has the lowest possible level of toxicity. And then in our more reactive patients, we do also perform some blood serum tests like the Clifford test or the Biocom test, so that we're, again, using the materials that are going to be least reactive for them. And some of our patients do like doing energetic testing. In my practice in Wisconsin, I did have a naturopath right in the office. I work with some practitioners that will do this type of testing. And I have some people that will actually just muscle test the materials right there in the room to find out what material they want to have used. The thing to remember is that there's no such thing as a perfect material. I wish there was, because then we could just, use that. But that is one of our challenges, is to find the right material for that particular person, because everybody is different. So what are the replacement options? So the first and most common one are the composite fillings. Those are the white fillings. And the reason they're called direct is because we place the material in the mouth in kind of almost like a paste form, and then we go ahead and use the light to harden the material. And the problem with that is that there is a certain amount of shrinkage of the material, and it's not as strong as we would like it to be. So despite the fact that it's relatively inexpensive and tooth colored, still a little bit more expensive than amalgam fillings, the disadvantage is that because of the physical properties of that composite, they do have a relatively short lifespan. And that is unless you're doing smaller front teeth, which is really what those materials were designed for in the first place. When these were designed at first, I don't think they were ever meant to be on the biting surfaces of our main chewing teeth. So one of the things that we can use are what are called indirect composites and ceramics. And by indirect, we mean that the actual restoration is fabricated outside the mouth. And so it can already go through that shrinkage factor. We can cure it under heat and pressure, and we can just get much, much better physical properties. And it does give it a much longer lifespan. And in general, they're also more biocompatible because in a lot of cases, you're converting a monomer, which is really reactive, into a polymer, which is less reactive. And if you can convert all of your monomer into these polymers, you have a much more biocompatible material than when you're trying to cure these materials in somebody's mouth. So the disadvantage is that they have a higher initial cost, and in most cases, they require 2 visits where you take an impression or something like that and then fabricate the restoration, and then the patient comes back and we put the restoration in. Now, I put initial cost because they are a little bit more costly when you place them, but because of the longer lifespan, you're probably replacing this. If you're putting a composite in the same place where you're placing an inlay, you're replacing this filling 4 or 5 times before you would ever replace the inlay. And when you consider the trauma to the tooth and all the costs associated with having to take time off of work and paying for the fillings, over the long run, these restorations are actually much, much more cost effective. And in fact, I tell most patients that if you want the thing that's best for your health and the health of that tooth, this is definitely the way to go. And when it comes to the 2 visit, there's also a big but there because we actually have technology, and I've been using this technology in my office for well over 20 years. This is a much newer version of what I had 23 years ago when I started doing this. It was actually a black and white big CRT monitor on top of this machine. But what this CEREC machine allows us to do is there's a scanner right here that allows us to take literally an optical impression of your teeth. So we're creating a 3D model, and then we're designing a crown or an inlay or any restoration we choose right there on the computer. And what happens is that data gets sent to this milling machine, and we put a block of whatever material we choose. Now, 20 some years ago, we had literally one type of material. Now we have, it's got to be well over 100, which is, again, exciting for me because it gives me so many more options and helps so many more people rather than just having that, the limitations of having one single material. And we put the block in, and what happens is, and you'll see this here, is that the 2 burrs actually grind out the teeth out of this block. In this case, I'm actually doing a bridge. And in a matter of, for a single unit, like an inlay, an onlay, or a crown, you're looking at usually in the 5 to 10 minute range that the final restoration comes out of that machine and is ready to be placed in the mouth. So you don't have to take the messy impressions. You don't have to leave with a temporary that, is going to fall out. And you don't have to make that second visit where you have to get numbed up again in order to place that restoration. We do it all in one single visit. So let me just show you a couple examples of what that looks like. This is one that I show to a lot of our new patients. And this was an example where a woman that she was the wife of a holistic dentist in Wisconsin, and she had broken a chunk of the tooth off right here. And of course, she was told that she needed a crown, but her husband said, hey, go see Dr. Mahn. He's going to do this in a more conservative way. So what we did here is we put the rubber dam on. This is actually the clamp and the rubber dam that isolate those teeth. And then what we do is we essentially prepare and just take out the old filling material. So we took out this filling, took out all the old amalgam, we cleaned out all of the decay that was present, and then we actually look to see how solid the rest of the remaining tooth is. And if it's solid, we're not going to grind that away. And unfortunately, 90% of the dentists, or probably more, probably 95% of the dentists would look at this and say, well, you need a crown. We're going to grind the top of the tooth away. We're going to grind the sides of the tooth away and then place that crown over the top of the tooth. And guess what would happen? You would literally be removing the rest of the healthy tooth structure. So we're able to preserve all that. We put a little powder on there, we scan it, and while this piece is being made, we actually did this filling here, and there was also a little cavity here, and we bond the piece in, and this actually took, and we were able to do this in one visit, and it took just literally 1 hour from start to finish. And that's how the patient walked in, and this is how she walked out an hour later. So it's exciting. It makes the job a lot more fun because people are happy that that they're not having to do these multiple visits and multiple injections, and they're leaving with nicely preserved teeth. A couple other examples. Here's some fillings. They don't look that deep, but when we clean them out, a lot of times you can see, those fillings are quite deep, and those teeth are really severely compromised structurally because these do nothing to really help the strength of the tooth. They're just sitting in there passively. They don't bond to the teeth. So when you're biting down on these teeth, it's the same as if you're biting down on these. And again, we milled some inlays, we bond them in, and not only do they look great, but these teeth are now as strong as they were before they ever had a cavity at all. So again, it's very exciting to be able to restore teeth like this to almost their original state. We're using digital imaging actually in a lot of different areas where these goopy impressions are almost a thing of the past. I mean, we're even using that scanner to scan entire arches and using it for doing braces like the Invisalign and the ClearCorrect. And just if you're not familiar, this is one of those miracles of modern dentistry. If you want to see how these clear aligners work, it's a way to straighten the teeth without braces. And instead, you're just wearing a series of these clear retainers. And again, we use our digital scanner to create a virtual model. And then that gets uploaded either to this ClearCorrect or to the Invisalign website. And from there, they basically fabricate the models. They 3D print the models. They create these clear aligners, the set, and then they ship them to us. And when they go in, you virtually can't tell that they're in the mouth. And one of the cool things is that when you come in for your consultation, is if you watch right here, you can see as it's moving through the retainers, you can actually see the teeth moving. So you're actually able to see your own teeth throughout the entire treatment, what it's going to look like retainer by retainer. It's very cool because normally, with orthodontics, people can show you before and afters of crowns and your front teeth, but to be able to actually see your teeth moving and what your jaw will look like after braces is actually pretty cool. So we're doing a lot more of the adult orthodontics because of that. In the past, we used to go, oh, well, you want these nice, beautiful straight teeth, but we're really finding that we're able to create stable bites. We're helping the jaw joint. It helps the airways, helps people breathe better. So I'll be talking about that in a little bit. And it also makes for healthier gums when you don't have the crowding. So there's a lot of advantages to having those straight teeth. And we're able to scan your teeth. We don't even, in our practice, we don't charge for that. And at your consultation, if you're interested in something like that, we can show you on the website virtually what your teeth will look like when they're all done. All right, well, let's talk a little about root canals. Root canals are another really points of contention, even, well, especially between holistic and the conventional community, but even in the holistic community, there's a lot of debate about whether root canals should ever be done. And probably the biggest problem is that we just haven't had as many studies done by universities as I would like to see, because the problem is if you find that a root canal tooth is a problem and you want to pull it out on an x-ray or from a conventional standpoint, they're going to say that tooth was just fine. And if you pull that tooth out, a lot of holistic dentists are getting in trouble with the boards because the boards are accusing these dentists of pulling, quote unquote, perfectly healthy teeth. So first thing is, what is a root canal? Not everybody, I just want to explain this real quickly because there seems to be some misunderstanding about what these are, but essentially there's a nerve that runs inside a tooth. And when you get a cavity and the bacteria get into where the nerve is, that canal fills with infection. It comes out the end of the tooth and forms an abscess. So what the dentist will do is they'll go ahead and make an opening into that nerve and use these files to clean out the infection and then basically just kind of obliterate that canal so that the infection can't grow in there. So, what's the problem? Well, when you're shown what the anatomy of a tooth is, they give you this really nice clean picture of a tooth with the enamel, and the nerve and the blood supply. The problem is that it's not quite that simple. And the problem arises in the root surface, which is not a solid material like the enamel, but in fact, it's millions of little tubules. And in a healthy tooth, you've got this, besides the nerve and the blood supply, you have this lymph supply that flows into the nerve, flows out through these tubules, and then flows out alongside the tooth. So it's kind of bathing that whole tooth and keeping it healthy. And of course, when you have an infection and you clean out those canals, that system, instead of this being this flowing, breathing, healthy system, is now stagnant, and bacteria can grow in here that aren't the pus-producing, infection-producing bacteria that we in the conventional community are used to thinking about. But instead, these are bacteria that produce some very powerful enzyme-inhibiting toxins that can, in fact, make patients very sick, but it's not something that's going to show up on an X-ray. And that's really where the problem arises. And, there's some more conventional problems with root canals, like the incompatibility of the dental materials. There's the gutta percha that we use to fill teeth is actually latex-based. And that material can shrink over time. A lot of times, dentists aren't able to get all the way down into the canal, so part of the canal still has infection in it and is never properly filled out. And sometimes the infection even goes all the way around the tooth. Some of these teeth that we pulled out, they have almost like this rubbery little ball around the end, and there's just no way to go ahead and ever fix that by going down into the canals. The toxicity that I just spoke about with those little organisms that are so difficult to detect, and then also the energetic disturbances associated with teeth. And if you've heard a little bit about the tooth organ chart and the energy meridians that run through the head and neck area, we do have, you've probably seen this, some of these tooth organ charts can be kind of hard to decipher. And if you haven't seen it already, we actually, on our website, we have an interactive tooth organ chart. And if you click on this and open it up, you'll get a little thing here. It says, see the teeth chart. And this is really nice because it makes it very simple. You can click on a tooth. So if you say, yeah, I've got an infected tooth number 14, it'll show you what organ systems are associated with that tooth. Or you can do it the other way around and say, hey, I've got some heart issues. What teeth are associated with that? And in this case, it happens to be the 1, 16, 17, and 32, which are the wisdom teeth, as well as 6 and 11, which are the upper eye teeth. So it's very easy to see, and you can look around. You can show some other relationships. It even shows some joints and spine and some of the glands. So it's a very, very easy way to make that connection between the teeth and the rest of the body. I think if we knew for certain that all of the root canal teeth were toxic, it would be easier sometimes to convince people to get those extracted. But even Dr. Boyd Haley, who used to test a lot of these teeth, said that all of these teeth are infected, meaning you can never completely eliminate the infection when you have this dead tooth in your mouth. But he felt that not all of them were toxic. And he did used to have a testing system where you could actually put a little paper point around these root canal teeth, send it in, and have these teeth tested. And then that way you would have some documentation as to why that tooth had to be removed. And unfortunately, that test was discontinued, and now we're in a little bit of a tough situation because it makes it very difficult for us to prove, not necessarily to ourselves, but to a conventional dental community, that these teeth had to be extracted. And there's something about the conventional dental community, they do not want to, almost seems like that's ingrained in us in dental school, that we want to save these, some of these teeth at all costs. And unfortunately, a lot of those teeth are much more problematic if they're lost than if they're extracted. Because it does create some problems, because if you start pulling these root canal teeth, what are your options for replacing those? You basically have the option of a bridge. You can do an implant, you can do a little partial, or you can leave the space. And I'll go kind of over each one of these. Now, the biggest thing to remember is that, again, just like with dental materials, there's not going to be a perfect solution, but you really just need someone to help you kind of make that informed decision. I just want people to have all of the answers that I can give them and give them as much information. And then when they make their decision, they say, okay, I got as much information as I could. And they don't run into a situation where they have teeth extracted and say, well, gee, I didn't know that I was going to have to wear this partial, or I didn't know I was going to spend, $8,000 to have 2 implants put in. And those are the things you need to know beforehand and to help you make the decision on how to proceed. So leaving the space is a lot of times, in some cases it can be okay, but a lot of times people don't realize that when you pull a teeth, these other teeth will shift. The top teeth will come down. These teeth will tip forward, and it really kind of creates a mess. And people come in like that and they say, yeah, they pulled a tooth and they said that, that would fix the problem, never telling them that all of these other issues would occur. Now, if it's the last tooth in the arch, a lot of times, even a second molar, you can get away with doing that. But generally, when you're pulling some of these first molars, it creates a lot of problems if you pull the tooth and don't replace that put something in that space. Now, the good news is, so this is actually a bridge, and just imagine there's this is the missing tooth. Essentially, what we're doing is we're grinding down the teeth on either side. So that's one of the disadvantages of the bridges, unless, of course, in some of these cases, you may already have very large restorations in those teeth. So it may not be as destructive to the teeth to grind them down for a bridge. But if those teeth on either side of the tooth that's lost are perfectly healthy, I would certainly not consider doing a bridge and destroying all that healthy tooth structure. But the good news is we can now make these teeth with a zirconium substructure, which is much healthier than the old metal options. The other thing, and a lot of patients go this route, is we have some really nice new thermoplastic partials, and these used to be metal. They had those big ugly metal hooks on them. These are very biocompatible. They pop in. We can even do, if we're just replacing 1 or 2 teeth, we used to not be able to do that with the metal, but they pop right in and patients find them to be very comfortable. They're generally much less expensive than a bridge or an implant. But of course, the disadvantage is that you have to take it out every night and keep it clean. And, if the dog gets a hold of them, they do like to chew these up. They can get lost. So they also have their disadvantages, but they're a great tool for someone who's not quite sure which way they want to proceed. And a lot of times we make this partial. And in some cases, they find that this works out just fine for them and they stick with the partial. Other cases, they may say, you know what, this thing really just bugs me. Let's go ahead and plan for an implant. And this buys them the time to be able to do that. Speaking of dental implants, these are implants that I started placing several years ago. And I never thought I would place implants, but I really started to have to, I kind of had to do these on my own because I couldn't get the oral surgeons in my area to place these for me. And that's really when I invested. This is a newer technology that I have now, but I had a very similar technology to this in my previous practice. And what it does is, what makes it such a powerful tool is if you look at an old panoramic X-ray, you're compressing all of that 3D information into one single plane. And so when I look at this root canal, and I know there's a sinus there, but I have no idea what the relationship is, if there's any pathology around those roots, it's really hard to tell. And with the 3D X-ray, it now gives us a completely different level of vision. We're actually able to look at the jaw in cross section. We're able to take this right here is actually a slice right across here. So we're actually able to look at the roots and the jaw. So we're able to see things that we could never ever see on the panoramic X-ray. And we can also use this technology to actually plan implant surgeries. And what I did here is I actually am using my CAD/CAM technology. And what I did was, this happened to be my very first implant case that I ever did. And what I did was I scanned, in this case, I actually scanned a model. But what I'm doing is I'm actually just drawing a little circle right on the ridge where I'm planning on placing the implant. And again, now this is an all digital model that I've created by using that optical scanner. And then what I do is I actually design my final restoration. And that was, one of the big problems with surgeons placing these implants is a lot of times they would place the implant where they just felt it was, the best for them based on where the bone was and where it was the easiest. And a lot of times it would be off the one side or the other, or the angulation that, they wouldn't be tipped properly. With this, I'm actually able to reverse engineer. So I'm able to take that restoration, I can place it in, perfect alignment with the other teeth. And then, the truly incredible part is I can, once I have the tooth where I want it to be, I go up here and I basically just go ahead and export that case. And what I do is I import it into, here's the tooth I just designed, and I'm actually able to now correlate a digital physical model with a 3D X-ray. And so all I do is I give the software some reference points. So I'm clicking on the same teeth, both on the model as well as the X-ray. And then once I give it at least 3 points, I just say confirm. And now you can see right here, the model is now integrated. And the cool thing is here, you can see exactly where the restoration is going to be. So it even gets better now. I can go into my implant library, and there you see the implants that we placed, the Z system at that time. And I just pick the tooth, I pick what diameter and length implant I want. And now you can see I'm virtually placing that, and I can see exactly where the bone is. I can see where my tooth is, and I just move the implant around till it's exactly where I want it to be. And then I can go here in the surgery tab, I can get a nice little surgical report. And the other thing I can do is I can order a surgical guide. Now this is a guide that snaps over the teeth. And the cool thing is it only allows me to drill it at the precise angle and depth that I've planned that implant in. And so it allows me to place that implant very quickly. This is actually the first case that I ever did right after the surgery. We used a tissue punch, so it was very conservative. And then I took another scan just to confirm that the implant was placed exactly where I had planned it. And here's what the case looked like. You can see a little bit of the implant, but it's tooth colored, so it's very biocompatible. It's very tissue friendly. There are really some amazing materials. Now the biggest problem, and actually I did tell this patient that that he was my guinea pig for placing implants, and he was quite happy. He actually sent me flowers the next day. So I think he's the only male patient that ever has sent me flowers. But he was very happy with the final result because it turned out absolutely perfect. And the biggest problem though with these implants is that because they're one piece, it makes it very difficult to protect them during the process of integration. And what I mean by that is when these get screwed into the jawbone, the bone actually grows around that material, and literally the implant integrates into the bone over a period of about 3 to 4 months. And during that time, you can't have any micro movement. So even the tongue moving or chewing or food, banging up against it can compromise that integration process and prevent the implant from properly, attaching to the bone. And so it takes a lot of patient compliance and a lot of work to protect those teeth, when in fact all of the titanium implant systems come in multiple pieces. So the cool thing is now there's a new system out. This actually just came out, and they've developed this new carbon fiber screw, because the biggest problem was in the 1-2 piece system that they had before. This actually was glued to this part, and these things would break and come off and create all kinds of problems, because it's hard to screw 2 pieces of basically ceramic together. Well, they've now developed this carbon fiber screw, and we can now place the implant. We can leave it flat, at or below the level of the gum, get very good healing, and then once the implant is integrated, then we go ahead and just screw that top piece on, put the crown on, and you get a very nice restoration. So it's very exciting to be, again, this is one of those things that we didn't have available a couple of years ago. And that's why sometimes the little partials are nice, because it helps buy patients some time. And right now I have a whole bunch of people waiting because we're literally expecting to get these sometime next month. All right. So this is again that 3D imaging technology, and just to kind of this actually happens to be my scan. I had 2 of these zirconia implants placed, and unfortunately the surgeon didn't feel that he needed the surgical guide. He said, "Oh no, I've flapped the tissue. I'm going to be just fine." He showed me a panoramic X-ray after he did the surgery, and everything looked perfect. But when you look right here, I had a 3D X-ray taken when I got down here. You can see this implant is actually sticking out of the bone. And in fact, when I stick my finger over here, I can actually feel the ends of those threads. So that's why we do the 3D, and it allows us to be very precise. Now, the other cool thing is, one of the things that's exciting is that we're actually able to use this 3D imaging software to analyze patient airways. And that's something that's really an emerging field in dentistry right now, because we're finding that that improper breathing and sleep apnea are a huge problem with patients. And this is, so that first one was mine. Now this is a patient whose airway wasn't looking as good, and my total volume here was somewhere around 33,000. My cross section, which is the where you see this slice here, was, I believe, 278. So you can see this patient has about 1/3, less than 1/3, the area for air to go through, and it really does create some problems. So one of the things that we want to do is we want to be able to move the jaw and the tongue forward and open up these airways so people can breathe better. So this is again, this software will integrate with my 3D scanning software, and I can actually order these appliances that help do that and help patients breathe better. So here you can see the digital models have been imported, and you can now see the teeth attached to the X-ray. And we then literally send all of this data, the X-ray, the digital scan, it all gets uploaded to the laboratory in Germany, and they fabricate this beautiful appliance that helps position the jaw in a more favorable location. And then our goal is to take that airway from being very constricted to opening up those airways and helping patients breathe better. So this is something that I'm really just kind of getting started with. My partner back in Wisconsin did a lot of this because she did more of the orthodontics, but this is a really rapidly growing field. And actually the Spear Center right here in Scottsdale is probably one of the leading teaching institutions in the world where we can learn from this Dr. Jeff Rouse. It's really incredible that I have the opportunity that he's right down the road from me. So this is something that I'm pursuing because I know it has a huge impact on my patients' overall health. It really, ultimately, to me, it really is all about oxygen. I think if people aren't breathing properly, if they're not getting enough oxygen, it really does affect their overall health. And that's why we use ozone, which really is kind of a supercharged form of oxygen. If you've forgotten since your days of studying chemistry, oxygen is O2, and essentially ozone is 3 molecules of oxygen. So it's really nice that we don't have to worry about. I guess we do have to worry a little bit about toxicity because you can irritate certain membranes, but for the most part, if it's applied properly, it can be very beneficial. And in our office, we use what's called a corona discharge generator. So basically what we're doing is we're running oxygen through basically these, I guess for lack of a better term, these sparks, kind of like almost like a thunderstorm or lightning storm would do. And if you've ever gone outside after a heavy thunderstorm and you get that clean, fresh smell, that's actually ozone. And sometimes people think, well, isn't ozone bad? I've heard there's like ozone alert days. Essentially, ozone is how the planet cleanses itself, and it concentrates in areas where there's high levels of pollution. And so because it's one of the easiest things to measure, ozone is actually not a pollutant, but it's actually an indicator of pollution. So if it's if it's used properly, it's a very powerful, not just an antibacterial, but also antiviral and also antifungal gas. So we can administer that and inject it in different areas, and it's very powerful at killing these pathogens. But what makes it even more powerful is that it actually activates your immune system and kind of initiates this healing cascade. So that's really where the power of the ozone comes in. If you're using antibiotics, you kill maybe, at best, most of the bacteria, but you're leaving a lot behind. And a lot of those organisms are now going to be resistant. So not only have you now weakened the immune system, the remaining organisms are stronger. And so you're actually in a worse situation than you were before. The nice thing about the ozone is most of the bacteria that we're trying to kill are anaerobic. So the ozone is very good at killing them. But because it now activates your immune system, your body will actually help continue to fight those infections. So in our office, we actually use it to minimize the health impact of root canals. So when people are concerned about that, but they're not ready to get a tooth extracted, we'll actually make perforations into the jawbone around these teeth or inject it into the tissue around the teeth, and at least hope to minimize the number of organisms there. And again, a lot of times it's just a way to help buy a little bit more time for the patients, because eventually we don't really think that it's a long-term solution, but it is a good way when you're not ready to get a tooth extracted and you may not feel that that tooth is related to any of the maybe medical issues that you're having. The last thing you want to do is start pulling out teeth. This is a good way, a very non-invasive way to reduce the impact of those teeth. We also use it to treat gum disease. I actually just purchased a new ozone machine that with a foot pedal and a little handpiece, we can actually deliver ozone right below the gum tissue. We also use it to treat teeth when we're cleaning decay out of teeth and we're very close to the nerve. Putting some ozone in there is a very good way, again, to kill the organisms, to kind of actually helps mineralize the tubules that lead to the nerve. And so a lot of times as we get close to the nerve, we'll put some ozone in there. And then we'll also use it to disinfect our treatment rooms and even ozonate water and run it through our water line. So it's a really fantastic non-chemical way of eliminating bacteria. So that's something that I've been excited about for a while. And this is actually, oxygen and ozone is one of the reasons, if you do know me, you may have heard my story about having Lyme disease. And that's one of the ways that I've kept my Lyme disease under control, is actually through the use of oxygen and ozone therapies. And for the most part, I feel like it's been very effective. All right. Well, that's a lot of the information that I had for you today. I hope you got some good new ideas, and I hope you learned a lot of new things. Again, if you have any questions, you're certainly free to give me a call and ask for a copy of the book. We'd be more than happy to mail it to you, or you can also go ahead and send us any questions that you have via email. But probably the best thing, a lot of times we can't really answer questions on the telephone. We do have a very good, we call our gift of health offer. So for $49, that does include your complete exam, even your 3D x-ray. We're also, at least for now, still including a cleaning through the end of the year. So for $49, it's a good way to get to meet us and to find out about our practice and find out what's going on in your mouth. So I thank you for your attention. If you've made it this far, I appreciate you listening, and I look forward to meeting you soon. Take care.